This morning on Today's Health, how to avoid a misdiagnosis. They're to blame for as many as, get this, 98,000 deaths a year. That's according to the Institute of Medicine, more than car accidents and even breast cancer. So how can you ensure that you're getting the proper diagnosis? We've got women's health contributor Dr. Keri Peterson here with some advice on how to be your own health advocate. Dr. Peterson, good morning.
Good morning, Ann.
This is really pretty shocking. 98,000. This is really shocking that many people die because they've been misdiagnosed. So the question is why?
There are such a multitude of factors, but one of the main ones is lack of continuity of care. Basically, doctors' offices are so inundated that patients aren't necessarily seeing the same doctor every time, and then you're not establishing a relationship with them so that they can really get to know you.
And also for older Americans, they may not be taking their medications, but for younger Americans.
For younger Americans, if you're a woman in your 20s and 30s, that's actually the group that's at most risk for getting a misdiagnosis. And the reason is that doctors are actually presuming that you're in this healthy demographic, and they may not necessarily think of a serious diagnosis at the onset. In addition, women in this age group tend to see their gynecologist as their sole practitioner, and that specialist really has a niche there, and you need to complement that with seeing an internal medicine physician to have more comprehensive care.
Okay.
And finally, lack of time is a big factor, both on the part of the doctor and the patient. You know, we live busy lives. We want to get in and out of the doctor's office, and so you may be more likely to just accept the first diagnosis without questioning it just because you want to move on.
Which gives a hint as to how you actually want us to change our behavior when we deal with doctors. We want to find good doctors.
Yes.
Do you have a quick tip on how to do that?
Yes, I do. I think a good place to start is just the internet. Google a doctor's name that you've heard about. Read review sites like angieslist.com. Also, you can look at the Department of Health's websites for education and training background. And I think asking friends and family is a great resource. They often have good referrals.
So you're saying really take the time to make sure you're in the right hands. And once you're in the hands of that doctor, it's not about coming in just for care. It's about also caring for yourself. You have to be an advocate.
You have to be an advocate.
How do we do that?
Okay, well, the first thing is you want to do your homework about your symptoms. So make a list of all the things that are concerning you. Look on the internet, see what those symptoms are, what they could be, so that you can remind the doctor, are there any other possibilities here? So you really want to be your own advocate.
Because you're saying that maybe, why is that? I mean, in other words, if they look at a healthy person, one of the theories is that if they look at a healthy person, they may not be as diligent as you might be. In other words.
That's correct.
And the other factor is I understand that a lot of people say that their symptoms are not listened to when they talk to the doctor.
Yeah, that's really important. First, before you're going into the doctor, a few tips that I have would be make a list of all your symptoms and concerns so that you don't forget anything. And also, sometimes it's actually even difficult to get in promptly. So be an advocate for yourself. Ask, do you have a nurse practitioner that can see me, or a physician's assistant that can get me in a little bit earlier so that you can be seen promptly?
You also say keep a copy of your records.
Yes, keep a copy. Keep a copy of your records and abnormal test results. So if you're seeing a doctor for the first time, you have that handy to give to them. And also know your own history. Know your medical problems, the medications you're taking, so that you can recap it with them. And know your family history so that your doctor can see if you need any screening tests that you may not even know that you needed.
You're making me think that it might be smart for us to have a medical file for ourselves as we go in and take notes as we're with our doctors.
Oh yes, taking notes is a great idea. Write it, you know, when they're maybe giving you so much information, it's hard to retain it all. So if you write it down, at least you have a little crib sheet so that you can check later on and just review it on your own, and maybe it'll absorb a little better.
And if your doctor is not listening to you, it would make a lot of sense to go see and get a second opinion about something you're really concerned about.
Absolutely. To follow up, you should certainly get a second opinion. And when you're at the doctor's office, be very forthcoming about your symptoms and ask questions. Don't be afraid or embarrassed to talk about something that's uncomfortable for you, like drug use or sexual history, because your doctor's not there to judge you. You are on the same team and you're there to work together. So give all the information you can and ask questions if you don't understand. Especially ask questions if you don't understand what your doctor's saying. We often have this language that we speak, all this mumbo jumbo, and it's going way over your head.
And we don't want to feel stupid, but in fact it's smart maybe to feel stupid sometimes and ask that question.
I ask them, I don't understand what you're saying. Can you say this in layman's terms? Can you put this in a way that I understand it and slow down a little bit? All
right, Dr. Keri Peterson, this is all very good advice, and hopefully we've helped some people today. Thanks for being here to try to do that.
Thank you, Ann.